All right, so we're here today with Dr. Julie Tilsen. She is a psychologist, as I understand it, who works in Minneapolis and also teaches some at the University of Minnesota, and has written a few books now on the application of queer theory in therapeutic practice. So thank you, Julie, for your willingness to be interviewed. My students will be very happy to hear from you. They're actually reading your book, Therapeutic Conversations with Queer Youth, right now.
Cool.
So
All right.
when I told them I was going to interview you, they were very excited. And one of them was like, oh, good, because there's parts of it I don't think I understand. So, but this is their
I
first,
don't understand too.
their first dip in queer theory, which I think for a lot of people is so different from how the rest of the world talks about things. So I'm wondering if you can kind of start us off maybe with helping us think through how you got to queer theory and how it sort of informs the work that you do. That's a really big question, and we'll keep unpacking that.
Yeah. Okay. And this is Juno. She's likely to be here. And I'm rocking my Billiken that Katie gave me because I have really bad COVID hair. Okay. So how
Great.
did I get to queer theory?
Yeah. How did you get to it?
There's probably a couple of streams I could get into that river. I'd say one is oh boy, this would have been like late 90s, early 2000s, as more queer and trans people were finding their way to my office, even though I wasn't explicitly hanging a shingle for that. I think I was just responding to some of their experiences and ways of understanding themselves that the ways I had available to me. At that time, I was really immersed in feminist family therapy, like the Women's Project. Was spending a lot of time paying attention to Marian Walters. So I think that in one way I would answer that by finding a lack of like conversational resources and conceptual resources that were responsive to how folks were showing up in my office. I think that other stream I would step into to get into the river of that answer would be, meeting my friend and colleague Dave Nyland in like 2000 and I think it was 4, and he was just finishing his PhD in queer studies, and we kind of hit it off. We were at a conference, we hit it off, and we started writing and training together. And so I was doing a little catching up to the studies that Dave had done, starting to do some of that more formal reading. And in a way, I think of it as, my experience with folks and their lived experiences not lining up with a lot of the resources we have, the conceptual and conversational resources we get as family therapists, then matching that with some of the conceptual resources available, in interdisciplinary spaces of social sciences like queer studies and cultural studies and women and gender studies and American studies and stuff like that. So that's probably how I got into it. It made more sense. I've always been probably much more a big picture person, and a lot of our therapy practices and models, I think, obscure what's informing them in terms of the larger cultural assumptions that they require that to uphold them. And so queer theory and more broadly, like social construction and post-structural theories made more sense to me as someone who's more, I think of myself as more of a culture worker looking at the world rather than as a therapist. And so that helped. And now my cat is like being stupid. Here, Juno, say hi to the class.
Oh, wow. Juno's just
I'm doing teletherapy now from home, and she's always showing up. I had a few weeks ago, one client said to me, "This is the most lesbian therapy ever." Anyway, so yeah, I don't know how that lands as an answer.
Yeah. So I think one of the things I think is important that you said there, and that I know my students are trying to understand, is like this question that I've heard you ask a lot, which is sort of, how do you know what you know? It's sort of an epistemological question, like, right? Like, so our family theories sometimes don't do that. Ask that question. Well, how do you know that it's that?
Right.
It's sort of like, it just is. Is that kind of
100%? Yeah, and I think that's fundamental to social construct, relational social construction and post-structural theories, is that we're asking those questions. How do we know what we know? And we're critiquing that, and then we ask more particular. If that's sort of the blunt or broad question, then if that's a butter knife, then we take out a scalpel and ask more particular questions, like who had the authority to tell us that, and who does that include, who does that exclude,
right?
What's the impact of that? And so I think that's very much what I mean when I say that, whether we're talking, Bowenian to Milan, there are assumptions embedded in that about, what makes a person, what's an identity, what's normal or healthy. There are, from Bowen, there are explicit ideas about what's healthy and okay.
Right.
To, my example of Milan, there may be more questioning about the effects of what's happening and letting people speak into that, which I would say, Milan is actually an early iteration of social construction and putting it into practice. There's all those things, like you said, Katie, that go unquestioned. And so for me, queer theory is about interrogating those things.
Right. Right. I think sometimes, at least when I've talked with queer theory with my students, they're looking for what some of the other theories bring, which is sort of concepts and ideas that start defining things. And for me, queer theory always brings more questions than answers. I don't know if you found that to be true, but I think sometimes that also trips up people the first time, because they're looking for answers in some way, as opposed to questions.
Yeah, and I think that's even, there isn't one queer theory. There are queer theories. There's different elaborations of that, and I think that's true. And I think that in itself is both reflected. It reflects modernity. What the Enlightenment gave us is this idea that we can know with certainty, and then we can have this way of knowing what's going on, so that we can then intervene or do something with some sort of certitude about a particular outcome. And for me, queer theory and the way a lot of folks live their lives now, whether it's around how they understand identity, how they understand relationships and kinship structures and stuff like that, it's about opening up possibilities and being constantly more generative and expansive, rather than reductive to this is the way and this is what we do.
Right. Yeah. So you've taken queer theory and started applying it or understanding it in terms of the therapy process. And I know there's another concept that's I think it's in all of your books, around relational ethics. And that seems to come out of maybe having or that implementation or application of queer theory in therapy. Is that fair?
Yeah, well, I'd say that, like, relational ethics, as I think about it and I think about what's influenced me, one would be a stream in social construction, Sheila McNamee writing about relational responsibility, and offering a critique of our conventional ethics, which really gets conflated. I think in our practices, in our applied fields practices, ethics have been conflated with legal stuff, and it's kind of cover your ass. And ethics becomes this. It's sort of like we have ethical conversations, or we bring them to consultation or supervision when there's a dilemma, when there's a problem or a conflict. And then it often is legal stuff, and we talk about documenting really well and those things. And not that that's bad or wrong, but if that's the only thing we focus on, it's little shit, right? Oh, she's a lot. We were gone for a week, and so I think she's still soaking up attention. Yeah. So I think that relational ethics, as McNamee writes about it, it is about looking at the everyday ethics. And I think of it as, when we're in relationship with people, when we're doing therapy or youth work or medical practice or whatever any of y'all are going to be doing, that's not innocent and benign. And I think there's embedded in that is this assumption, because we're helpers, and we're wanting to, okay, now she's chewing on my rainbow tassels. You have to go far away, little one. She's going to pull down my diploma. So, what was I talking about?
About the everyday relational ethics.
Yeah. What we do is not benign or innocent, and I don't think we want it to be. We want to have an effect on people, but we have to have ways of being accountable. And if we take a one-size-fits-all codified ethic and then impose it across relational, cultural contexts, we can never have a one-size-fits-all ethic.
Right.
So that's one thing. And then with queer theory, I think of more of queer ethics from, queer organizing that have a more collective and relational way of understanding things. That's sort of the other dimension, area that's influenced me. So yeah, there's queer theory or queer ethics. Michael Warner writes about that, and then the relational responsibility, and then it in their seminal book, Jill Friedman and Gene Combs, and what is their book? Narrative Therapy. Constructing Preferred Identities, like the one from '89 or whatever. They talk about ethics as questions, and it's in particular asking questions about the effects of what we do. And I think that's the other thing that gets left out in our professional codes of conduct, is we're not turning those questions back on, does this way of engaging with clients center like professional knowledges or other knowledges, or their knowledges, who's got the authority to ask those things. So actually interrogating our practice is an ethical practice too.
Sure. Yeah, so we're back to those questions again, as opposed to answers. I know, like, even with ethics, actually, there's our first year master students always take ethics the first semester of the first year, and they're hoping to get the rules, like the rules for therapy, or kind of how not to get sued, maybe is another way to think about it. But I'm always hoping we're teaching it in a way that opens up some of what you're saying, which are sort of what are the questions we need to be asking ourselves, maybe all the time, not just when you have a conflict, not just when things aren't going right.
Right. Well, what's essential in ethics is it's about power. it's about power operations. And we often think about being responsible for clients, but I think we need to be accountable to clients. And that's a shift in positioning, in power, rather than having a paternalistic kind of way of seeing clients. Is seeing, I see clients as 100% capable, and I'm accountable to them. They're the ones hiring me, and I need to account to them for how things are going. Not the least of which is are we doing anything that makes a difference for you?
Right.
So, I mean, even to me, an ethical matter is, are we being helpful is determined by the people we're talking to, not am I being a really good structural family therapist? Am I doing that right? It doesn't matter if it's not helpful.
Right. Yeah. You're making me think of something that gets written about a lot, or at least used to in therapy textbooks, about the resistant client. Like the client who won't change, which is really won't change in the way the therapist thinks they should, right?
Right.
And that being sort of maybe the responsible for, because I think I need to change you in this particular way, versus accountable to, where we want to wonder where, if the client is seemingly not changing or quote unquote resistance, what's happening for them in terms of maybe something I need to change or something that's not working on my end, or how would you kind of say that?
When I think about resistance, then I think I've got some expectation of what someone's supposed to do.
Yeah.
And I have an expectation about my sphere of influence. And it's positioned me in maybe not as a combatant, but I want to be positioned with them in partnership. And if there's resistance, I see that as a protest, that I am not having the kind of conversation they want to have, or motivational, motivational interviewer people, would say everybody's motivated to talk about something, and it's our job to find what that is. And so, I think of, like in a family context, often, parents will bring in a kid and talk about them being resistant. And I'm thinking, well, that's an act of agency. It might be a protest, and it may have some problematic effects or implications for the relationships or for individuals in the family. And so, but for me, it's not about tamping down the resistance, or pushing someone into submission in some way. It's trying to understand that, so that we can have a conversation that everybody's interested in having, and doesn't make the 10-year-old resisting something doesn't have to be the one being pushed under the bus or something for to keep the status quo going or whatever.
Yeah, I mean, in the old family therapy literature, that there's the identified patient, right? There's
Exactly.
the one with the problem, and I feel like early systemic therapists were very interested in not doing that, and in implicating sort of everybody.
That's right.
And sometimes I feel like we've gotten so far away from that, and I don't know how that happened, but I have an idea about how that happened, but
we know how it happened. Yeah.
I
mean, back in the day, I would have turned to parents and say, have you thanked 10-year-old, Junior, for bringing us all together to talk about how things could be different?
Yeah. Very strategic move. Mm-hmm.
Yeah.
Mm-hmm.
Yeah. Well, we've gotten away from that understanding, and we're really focused on the individual, which is super problematic.
Yeah. And it plays out all the time still. And I wonder if this goes back to what you said at the beginning about some of those cultural forces at work.
Totally.
That totally like seep into our practice.
Well, our therapists are not, our feet are on the ground. We're not walking above the ground. And therapy, like I said, is not benign or innocent. And those practices, they're not, they're not the right way. Every approach or model is a metaphor.
Okay.
Everything's a metaphor. It's not real. So, yeah. So I think that all that is to say that therapy is always going to be a product of and reflective of and reproducing of larger cultural, discourses, unless we continue to ask questions about it.
Yeah. Yeah. Unless we stay curious about where that comes from or why
Mm-hmm.
that is. I think you said this. You can tell me if you didn't say this, but when you just said all these different theories are metaphors. I don't know if it was you or somebody else who I know who's a lot like you, or has a similar sort of positioning as a therapist. But most of us, when we find a theory we like, it's really just language we like. It's
Mm,
just the language we prefer to say and use and construct our world with, and isn't necessarily truth with the capital T,
right.
about things.
Yeah, that makes sense. And yeah, that makes sense. And the thing to remember in that is that language, so what's called the received view of language, kind of a modernist conventional understanding of language, is that language is descriptive, that it only describes things because there's realness that can be described. But um, from a constructionist perspective, language is productive.
Mm,
It's creating realities.
right.
And so when we find language that suits us for something that helps us speak our ideas or ourselves or how we understand things into the world, that furthers the production of that.
Right. Right.
Yeah. So there's one of my favorite Wittgenstein quotes is, "The limits of my language mean the limits of my world." And
Mhm.
for so many queer and trans people, when I'm listening to them, particularly when they're maybe earlier on in their um, sorting out their experiences and how to make sense of them, I'll tell them that quote, and they're like, "Yeah, I mean, it was all that when they first heard non-binary or genderqueer or ace or whatever, that because up until then they're looking for those right ways to be in the world, but it didn't suit them.
Right. Right.
It didn't describe them, and it
Right.
just made them feel further out,
Yeah.
outside. If there's no language, that's like our social currency is language. Yeah.
Right. There's no language, then maybe it means I'm bad or wrong or need to change or to fit in, sort of that belonging part too, I have to imagine, where once you have shared language, you can create groups and advocacy and, that kind of thing. Whereas when it's absent or it's being called other things, like it gets sort of marginalized. I know I've heard you talk through that a few times too, around the power associated with language, and then kind of who gets to say it or who gets to use it, that kind of thing.
Yep. Right. Yep.
Yeah. So in your work now with queer and trans folks, given how queer theory's been applied for you, what has that opened up, or what have you noticed about how that sort of really changes the therapeutic conversation you get to have?
Hmm. Boy, that in some ways that's hard just because it's just so there for me. I think what I think about is it's how do I say this? Um, I think as old cisgender person, it gives me some credibility and some permission
Yeah.
um, to be in lives of other folks. Um, because I'm willing to, I'm able to suspend certainty about stuff. I can ask questions about things that, um, make being in complexity or uncertainty okay.
Mhm.
And so I think there's that. And then I think the other thing that it does is, because it's very much about interrogating and critiquing norms and assumptions, which is about exposing power operations, it's also helps folks do the same thing. And while it may not change the material conditions of the world we live in, it changes how they're in position with things. And so then they don't necessarily feel like you were describing a moment ago, Katie, other, disbelonged or whatever. They can see that those are those discursive, cultural forces,
Mhm. Mhm. Mhm.
that it's the problems are from the outside in. They're not from the inside out.
Right. And they can maybe have some agency
Yeah,
power over that
yeah,
now because they can see it as out there as opposed to in here.
yeah. So they can stand in resistance to it. They can protest it. They know if they're, that um, despairing and, being depressed, having anxiety, that those are responses to those things. It's not about, bad brain chemistry or something wrong with me. That those are responses to, oppression, and, it's oppression, not depression. So
Yeah.
yeah.
Yeah. Actually, you reminded me can I quote your new book that's not out yet?
Yes, you can.
Okay, I got to read it, and there's a quote in there that I still think about. And you were talking about somebody who's suicidal and about how we need to talk about it as suicide as a product of oppression. And so, what killed this person? Homophobia or transphobia, as opposed to themselves. Like this idea of really externalizing even that event or experience to like properly place the power, maybe,
Right.
or sort of who is influencing this or what is influencing this. Um,
Yeah, and when we do that, then we also have to, that means we have to come up with different responses to it. It's not just individualized mental health treatments or whatever. That means we have to respond to poverty and and lack of homes, or
right.
all these other things. Um, yeah.
Yeah. Well, and I
And
think,
that and then we have to understand, wanting to remove oneself from those conditions may not mean they're sick, that they have psychopathology, that we all have our limits of how much whatever we can take,
right.
and that wanting to remove oneself from those conditions might not be an unreasonable response. That might actually be uh, a response of, I don't deserve to deserve this shit anymore.
Right.
Yeah, so there's really good work that I'm not always super up to date on in the critical suicidology field. Like Jennifer White is really good. She wrote the foreword to my second book.
Mhm.
But those folks address this stuff really well.
Okay.
Critical suicidology.
Yeah, 'cause I do think that certainly is one of the top. I mean, any of the mental health diagnoses plus, suicidality, things like that, get individualized very quickly, and don't often they take in what people are trying to do. What I find is like reduce their own anxiety as a therapist in that present moment with kind of what to do or trying to follow the rules of an ethical code, but then not thinking sort of bigger picture about what might be happening or where actually effective intervention might best be placed. I don't know if you've seen a
Well, if I'm understanding, like, yeah, people get really freaked out about this, and understandably, but maybe wanting to go really quick to safety plans, or
yes,
trying to
yeah,
cheerlead why someone deserves to live and
yeah,
what they got going for them, that kind of
yes,
stuff.
yes,
Which,
that kind of stuff.
yeah, and I want to understand the despair.
Mm, yeah.
I
Yeah.
want to witness it. I want to understand it. And I want to unpack it, um, and possibly, place people in resistance to the things that, um, bring about that despair.
Mm-hmm. Mm-hmm. Yeah. So not sort of, I mean, in some ways I hear you sort of like maybe joining them where they're at. And not pushing them past that too quickly or not.
Oh, right, right. Yeah. Eventually I'll ask about, plans for living, or like, if they say I can't take it anymore, what was it that you used to be able, that made it possible for you to take it, and what happened to that, where'd that go?
Yeah.
I mean, that's called double listening, or the absent but implicit, which is practicing narrative therapy. But I want to listen on the other side of that. um, but yeah, I think that, like you said, people can get really that, I think, get nervous about it. So I think it's about finding a way to hold your concern about what's happening, while also having a conversation that helps you kind of lean into understanding what's happening without having to try to fix what's happening right away.
Yeah. It's sort of I think there's a book even called It's Helping That Doesn't Help.
Hmm.
Um, where some of our urges to do different things or create immediate safety don't necessarily actually help, particularly when they're
Yeah.
very individually focused and we're not thinking about um,
Yeah.
the other sort of contexts or environments these folks are going back into.
Yeah.
Um, yeah. So I kind of, before we started the recording, I told you I have a case. And I'd be really
We're not
curious.
going to talk about your kids, are we, Katie?
Well, no. Probably should. I mean, I could use some help. Um, so, and I would be really curious about sort of a, as I consider sort of the application of queer theory, and it's a family therapy case. Um, and it's with a queer young adult
Okay.
and their parents. Um, and sort of, if you were approaching this case, what you'd be thinking about, what questions you might be asking, whatever your sort of thoughts are. So there's a mom and dad, cisgender, heterosexual, religious background. There's a young adult, queer kid who's been out for a number of years. I mean, at least a decade, I think, at this point. Parents, immediate rejection when they were adolescent age, and have now come around. They're trying to make repairs. They're trying,
Is this a white family?
white family, mhm.
And
Um,
what's religious affiliation?
Lutheran,
Okay.
formerly of a more conservative bent, now moving towards a more liberal, whatever, but still very Lutheran. Um, so the parents have changed churches. They've changed. I mean, they're reading books. They're trying to sort of have a new
Wow.
way of seeing. Yeah. I said wow too. I'm like, that's impressive. And they want to repair, right, with this, their now young adult kiddo. The first couple of sessions, like the parents were really open and we messed up. We're so sorry. Like did a whole thing for about 2 or 3 sessions, trying, like working on repairing. Parents are crying. Kid accepts it. Young adult person accepts it and is like, wow, that's really amazing. I'm actually kind of surprised. This is great. Um, and then the fourth session, the mom goes, okay, so it's your turn to apologize. And so there's like this moment for me where I'm like, wait a minute. And it's led to sort of this stuck place in the case where uh, the mom in particular is really waiting for this kid to own the times when he or they were pretty mean um, to mom, or maybe said some pretty terrible things, which I believe happens, right, when people are angry, and that certainly
Yeah.
can occur. And the young adult is going, I don't want to rehash all of that. Like I don't, I'm not even sure what you're talking about. I don't, like doesn't even want to go down the road. And so we're sort of sitting here with mom wanting this, kid being, and in fact, she's not being very clear about what she wants. Kids going, can we move forward? And the mom seems really stuck, even after all of this repair that's happened and seemingly warmth that I saw in the room. So,
So
what
what did
questions do
you
you
do?
have? What would you be wondering about with
What
this family?
what did you do?
So, so I encouraged mom to talk through like some of the pain she was holding on to, and like, and without the kid in the room, like help me out, like what's happened.
Oh, you dismissed them?
Well, the kid said, the kid said, I don't know that I want to show up anymore. And
After mom asked for apology.
mhm.
Okay.
And I said, oh, I mean, like, obviously you get to decide if you want to be here or not, right? Like, okay. And the mom's like, well, how about I just want, could dad and I just spend some time with Katie and see if we can figure this out, and then we'll have you come back in. And
Okay.
I said, great, let's do that. So we did that, brought the kid back in, and then mom unleashed on him, like just unleashed, with the volume level and amount of pain in her voice was really big, and I kept trying to slow it down and hold on, like all the stuff you're supposed to do to manage conflict in a therapy session. And the kid like looks like, oh my, like they just got hit. And then and then the kid was like, I don't know if I can come back if that's what it's going to be like. And I'm like, yeah, no, I understand that. And then mom and dad and I had a separate session kind of talking through that. And there's some pain in, so this is my concept, like there's some pain that mom's holding on to that I think isn't necessarily about the kiddo. And I'm not really sure what it's about, or even how to help her sort of, or ask questions that would deconstruct what's happening, in terms of her own experience, because she gets sort of so big about it. The other thing that's come up is, she's said to me like, well, you just want me to accept his reality and nobody's accepting my reality. And because we've talked a lot about validation and not agreement, blah, 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 blah. Anyway, so that's kind of where we
Okay.
sit at this moment.
So let me just see if I have this. So
Yeah.
they had rejected this young person
Yep.
earlier on, and then decided that the young person decide they wanted to reconnect.
No, the
The
parents.
parents did. Okay, and then you had some sessions, and that seemed to be going okay.
Mhm.
And then Juno, don't push that around. That was Juno manipulating her environment. Okay. Then the mom said, we've apologized. Now I want an apologize from this young person.
Yes.
And so then you said, well, let's meet just the parents, which that makes sense to me too. And then you seem to think that mom was ready to meet with this young person without asking for an apology, but then she continued to ask for the apology.
Yep.
What is she wanting an apology for?
He's been mean to her in the past.
Yeah.
He's hurt her
Okay.
feelings, which I mean, I believe her. Like, I don't,
I believe that too.
yeah.
So part of me thinks that this isn't even about queer stuff. This is about what are her expectations? Like, how old was this young person when they were being mean? And like, what are her expectations, and how well does she understand? Like, how well does she understand what it was like for that young person to be rejected by parents, and what does she see her mission as a mom is?
Mm,
And
mhm.
how can she live into that? Because I'm thinking that at some point parents can expect young people to not be little assholes to them or whatever
Yes.
when they
Agreed.
reach a certain age. Or if this is a young person who had been rejected and disbelong, I mean, what is it that parents are responsible for and owe to young people that young people aren't responsible for and don't owe to their parents.
Yeah.
So
Right.
I just wonder about unpacking some of that stuff.
Yeah.
Um,
Yeah. Well, then,
and then if where so there may be some general stuff around that, and then what are the particulars around gender,
hmm,
um, and is that, I mean, I don't know, would guess that you all have had this conversation around their expectation that they had a child who was gendered this way, but
yeah.
decided that that's not who they are,
Right. Right.
and what's in there. I also, I mean, you're more of an expert on this, but I'm always wondering when people with a particular religious orientation that's really central. I'm always wondering is the responsibility even more than is already there placed on moms for, like, is this a reflection of her being a bad, Missouri Synod Lutheran or something if her
That's
kid turns
exactly
out,
it.
yeah.
Yeah.
And then I'm also wondering, is dad asking for an apology, and why not? And is there a way that he can be a resource for her, to partner with her around stuff? But I just wonder about the extra burdens on moms and the meaning that's made of that within some of those religious communities.
Mhm.
Is she a bad
Mhm.
Lutheran mom? I don't
Mhm.
know. I mean, I
Yeah.
know that, yeah, I mean, is that a thing?
It's a thing. I mean, so this is a family that was very traditional, stay-at-home mom, dad working when kids were small. She bared the brunt of parenting and all the things. And so in terms of like eh, deconstructing some of that maybe role as a mother or gender as a woman in terms of how much she feels like she's carried over the years, I imagine.
Yeah. And, this is something that she shoulders, that it's her failing as a mom, then that means she also continues to see there's something problematic with being trans.
Mm, yeah. Yeah.
Um,
That's a good
I mean,
question.
it's implied in that, right? And so and I'm also wondering about the false equivalency of a young person being mean, if that's what she's saying,
Mhm.
to a parent with being rejected.
Yeah. Oh,
And so is she needing, in terms of the theme of forgiveness, I mean, is she also needing to forgive herself more? Like, I mean, I just see her, what was the conflict in terms of supporting her child and living into the demands of her religion?
mhm, mhm,
And then I just, would want to ask her questions about what kind of God she wants to traffic in, or be connected to.
mhm, mhm.
I
Yeah.
don't know.
Yeah. No, that's a good question. I think too, like, when I think of myself in terms of positioning in the family, I was thinking a lot about that comment you made earlier about being responsible for versus accountable to. And I find myself in families where I feel stuck, I start to feel that responsibility positioning where I feel like I need to come with something,
Yeah.
you know, versus be accountable to in some way.
The other thing is, it sounds like this all happened really fast, like 3 or 4 sessions. And so I also think of, for all of them,
In a few minutes, probably.
JoBear!
We're almost done chatting, okay? You don't have a cat, but or we do have a cat, but the more likely culprit is a 6-year-old. So in our house
For what?
for interruptions.
I love your cat. I'm the only one in the world that loves your cat.
Might be true.
Show him. Show.
We'll show Julie mine in a little bit.
Show
Um,
So we'll probably be done pretty soon, JoBear. Can I keep talking to your mom for a little bit?
I'll be out in a minute. Okay,
And then we're going to Daniel's house.
we'll go outside. Okay,
When?
in a few minutes. We're gonna just finish chatting.
Go play in the street.
Yeah.
That's what you do. Well, that's true. We live on a dead end street behind us, so that's actually true.
So the other thing I was thinking is not seeing this as an all or nothing, that they're disbelonged and cut off and rejected, or they're all completely happy and loving each other. That, and I think that that's something, I would go back, 2 months ago when we first started talking, and I might do some circular questioning, around if I had said that y'all will have had 3 or 4 really meaningful conversations together and you're feeling more connected or whatever, would you have believed me when you first came in?
Right.
So if that seemed, no way, I wouldn't, you would have been crazy. Okay, what do you think 2 months from now you might be realizing that seems unbelievable now?
Mm-hmm.
And then, what made that possible, and what are you all doing, and things like that. So I think also not having this be an all or nothing, and that I wouldn't see this, it's not a straight line, no pun intended, so does this mean we're having conflicts now like families have conflicts?
Right.
To be mad at someone is a connection. They were disconnected. If they're able to be mad at each other, we don't get mad about things that don't matter.
Right. Yeah, in some ways they're entering sort of maybe your typical family. And would that be a better place than where you were? Maybe not where you want to be, but it's, we're here now.
Yeah, so I would just, and I think that avoiding the all or nothing in terms of parental acceptance is really important. Like, these might be parents that are able to use this young person's name, not dead name them, and use their gender pronouns with them, but they may not do that all the time in conversations with extended family yet or something.
Yep.
And that's all, that needs to count,
Right.
So think of that too.
Yeah. And I think that's a good point, because I think they're sort of like coming along. They're doing it more than they were before, and it's been an improvement in terms of where it was.
And the other thing I think about, like, for the parents, you said they've changed churches. Are they feeling supported too? Because
that's a good question.
One thing I might do is I might have them talk with other parents. Is I would wonder about having them talk with parents who have a trans kid, maybe around the same age, but they're maybe a little further along in terms of their understanding, and just whether it's an informal thing, they meet up for coffee, or if you can bring another parent or parents in, and something so that they have some support, and they can maybe ask some of those questions and things like that. So I think about that stuff. And then, with the young person too, like helping them not see it as an all or nothing.
Yeah. No, that's very helpful. I think those are important, maybe questions or ways of reflecting on the process to this point without sort of losing what's gone well. And, that old saying, throwing the baby out with the bathwater, like, let's keep the parts that have worked, or acknowledge them as best we can.
Mama,
Yeah.
I do this. Heart.
Got the heart.
I'm never good at it.
So we're getting to the end of maybe some of my questions. Is there anything we haven't talked about that you think is important in terms of, for their new therapists to keep in mind about the use of queer theory and some of what you've
Yeah.
How to learn.
Well, one thing is people will often say, you talk to clients like that and all those big words and stuff. And I'm like, no, just like I imagine if you're doing structural family therapy, you're not talking about, what is it? Subsystems and
Yeah.
subsystems, and you're not doing that, or you're not talking about individuation and triangulate. You're not actually using those words. Those are informing how you see things and understand things.
Right.
And so it's just that when you're reading something that's new, that stands out for you. But the language you're given in other models or approaches, number one, they're founded on assumptions that you're already living in,
Right.
about authentic self, in the skin-bound container, rather than being discursively produced and non-essential and things like that. So no, I think of that as those are like applications, things that I have open and are operating back here for me to draw on. But the screen I'm sharing with clients is going to be using their language and their aesthetic and their understandings. Now, do I have a lot of people coming in already using the language of queer theory? Yes, I do.
Okay.
And then I will use it. But that would be one thing I would say.
Yeah.
Were you gonna say something?
Well, you're reminding me one of the ideas I've always drawn from social constructionism is this idea that language is always local, knowledge is always local. And so if you're working with a particular client, you need to sort of stay in their language. And if you get too far away from it, it doesn't resonate.
Yeah, right. Yeah. So like Gertz, the cultural anthropologist, Gertz would talk about experience near or experience distant descriptions. We professionals will tend to traffic and experience distant descriptions using professional language and things like that. And an experience near description is when we use the language people would use to describe themselves or their experiences. So I think that's one thing. And I think it's also important maybe to take some of the questions, that queer theory has and sit in front of them yourself, ask your own self questions about how you understand identity and gender and sexuality and things like that, and do that first.
Yeah. Well, yeah, you're reminding me, like, a lot of our students really, really like postmodernism. They like social construction. They like the ideas. They like queer theory. But if you ask them, do you believe it? Like, how do you describe yourself? It sounds very modern. Or
I think, and I see that, when I see that, I think that happens a lot. I think, and I see often, whether it's therapists or I see it like activists have a great analysis of of white supremacy and heteropatriarchy and capitalism. Yet when I work with them and they come in, then they, essentially they have a psychopathology, they have bad brain chemistry. Okay, do not pull this down, kitty. Going to make a big crash and boom. Yeah, and it's like all those things that you have an analysis of, in larger institutionalized and systemic ways, they're operating on us as individuals. I see that with activists, and I see it with some therapists who have studied social construction, and they're good with it until they do research.
Yeah.
And then they're like, oh, but we need evidence. And the furthest they'll take them is like some grounded theory thing or something. Yeah, and so I think that's really true. And so to really think about, yeah, what does it mean to understand people, identity as being, okay, really, she's gonna break me. Sorry, everybody. What does it mean to understand identity as being discursively produced, that we are relationally made? That, and as Bakhtin would say, that in language, if we're speaking words together, I only own part of that word. You own the other part of that word. We're making this meaning together.
Yeah.
And so what does that mean?
Yeah. Yeah, it's funny. The longer I've studied attachment theory, the more it's very relational in the way, but then it gets spun into this very individualized, well, you have this style, like it becomes like another diagnosis we give someone, like you are an anxiously attached person.
Yep.
And I remember talking to a professor once about that. I'm like, well, but I'm only
anxiously attached right here.
I'm only anxiously attached in this context with that person.
That's right. That's right.
You get me to a different context, a different person, I will behave differently.
Same with like freaking like Myers-Briggs.
Oh yeah.
Mm-hmm. Any of those things, that we're all multitudes, and we might have inclinations, places we're more comfortable, that we aspire to in terms of how we show up. But we're all, it's the thing that we create between us.
Right.
And it's like when I work with couples or whatever, I'll say there's you and there's you, but then there's what you create together, and it's its own thing. What is that antique?
That's what the kids said. They go, how old is that? What?
Hey, you have boogers in your nose. Thanks, Joe. Weirdo.
Mm-hmm.
Yeah. So, I mean, I don't know. Is there something that you wanted me to say as advice to your students that I'm not thinking of?
No, I think this is good. I think it's just like hearing you kind of talk through some of these things. And then sometimes I think there's a difference between like reading it and hearing it another way, or having an example that helps you make sense of it. So I think this has been really helpful. Oh, I don't know if that's been helpful, but this conversation has been helpful, and I really do appreciate your time.
Of course. And if this raises more questions or whatever, you can send them to me, or if you're doing a synchronous time, I'm happy to answer questions live.
Okay. Awesome.
Whatever works.
Wonderful.
Let me tell you something.
Oh, what do you need?
Jay? What, Joe?
Kept getting was from this backpack.
She's a magical backpack full of all the things.
Yeah. I saw you pull a bunch of stuff out of that a little bit ago. Are you keeping your teeth in there?
No.
Joe, will you send me some money when you get money for your teeth?
Yeah. No. No.
That was surprising.
No.
Oh, all right.
I'll send you some nut goodies.
It's candy.
You can only get it here. You can't get it there. Okay.
All right. Well, I'm gonna stop recording here.